like to ask anyone in attendance to declare any interest before we move ahead. Great. Minutes of the 2019-20 AGM. We have the minutes of last year's meeting in the pack. I will assume those are correct, and I hope to say, yeah, and I can say that we have approved them as correct. Thank you. Now I'm going to discuss the Chair's review of 2020-21 and the fantastic achievements of North East London CCG. I will talk briefly about the past year before I hand over to our Acting Chief Finance Officer, Steve Collins, and then to Henry Black, our Acting Accountable Officer. What a remarkable year it has been. 2020 and 21, and even now continues to be the most challenging year now for years the health and care system has ever had to contend with. We're living through extraordinary times for health and care. Whilst we continue to prioritise the management and delivery of the local response to COVID-19 jointly with our hospital, community trust, local authority, primary care and other partners, we've also seen the formal coming together of the former 7 CCGs across the area to become a single North East London CCG, serving over 2 million people across 8 local authorities: Barking and Dagenham, City of London, Hackney, Havering, Newham, Redbridge, Tower Hamlets and Waltham Forest. My fellow chairs and I work closely together to ensure that we retain a local focus but continue to support each other and collaborate when it makes sense to do so. Following an overwhelming majority of votes by our GPs in North East London in favour of creating that one CCG from April of this year, good progress has been made to develop a clinically led organisation informed by local people and patients with strong clinical leadership and a GP voice at all levels. I expect and hope that primary care remain a strong voice as the new system develops. Working together on the challenges of the pandemic with our health and care partners in North East London, we've made some great strides towards becoming an integrated care system, or ICS, achieving official designation from NHS England and improvement last December. This is an approach that will ensure that we've had the infrastructure we need to provide the best health and care for our local populations and be ready for the proposed legislative changes. I now want to take a few moments to recognise the work and achievements of those previous 7 CCGs. There are a huge number of achievements and I will only name some. They all did good things for local people and made a real difference to people and their lives. And there are too many to highlight to go through in detail. So please look at our annual reports on our website for more information. Firstly, in Barking and Dagenham, we made significant improvements to diabetes care and treatment, cutting the number of undiagnosed cases by over 1,000, producing patient information videos on foot care by our GPs in communities, in different languages, and reviewing patients in local parks during the COVID-19 lockdown. In Redbridge, there was an award-winning atrial fibrillation work for people with heart conditions, and we saw a sustained increase in the number of patients receiving high quality care for their condition, and it was recognised as the most improved borough in London last year with real patient impact by preventing strokes. It was a model we developed with our partners in BHR-UT and was adopted across BHR CCGs. It's just one example of the way we work in partnership to benefit our patients and communities. In Havering, our borough with the highest population of older people, partners across health, local authority, voluntary and community sector have pioneered work to make the borough dementia friendly. In addition to this, CCG and NEL colleagues have led a work plan to deliver a health and wellbeing hub on the site of the former St George's Hospital in Hornchurch, a really exciting project that has recently submitted its outline business case to NHS England and improvement. In Waltham Forest, the Waltham Forest Integrated Discharge Hub was launched 18 months ago to support the safe and timely discharge of local residents from Whipps Cross Hospital and other hospitals outside of the borough. A team of skilled therapists, social workers and social care assistants provided support for residents to enable them to return home safely and remain at home while they recover and improve their independence. This has reduced people's stay in hospital by up to 5 days. In City and Hackney, our colleagues in City and Hackney developed an innovative, user-friendly digital platform for people with severe mental illness that allows them to access important health information on their phones or other digital devices. It also offers patients space to create a personalised recovery plan supported by a wide range of apps, as well as personalised logs and health tracking, access to personal health budgets, and the opportunity to share information and interact with professionals involved in their recovery. In Newham, in response to the impact on children's and young people's mental health and surge in referrals, Newham CCG was the leading partner in developing the Newham Multi-Agency Collaborative. The collaborative aims to reduce the mental health impact on young people waiting for a child and adolescent mental health service or CAMS intervention. It worked by coordinating a pathway to timely therapeutic support through interventions provided across a broad spectrum of partners, including the CAMS service, school health teams, and a wide range of other health and voluntary and community sector organisations that supports young people. In Tower Hamlets, our colleagues there had a long and successful track record of partnership working. Through the Tower Hamlets Together partnership, the Born Well, Grow Well Asthma and Wheeze project had successfully reduced the number of children and young people admitted to the Royal London Hospital with asthma and breathing problems. Like many of other examples I've talked about, this work has been recognised nationally through a recent win at the HSJ Value Awards for Best Paediatric Care Initiative of the Year, so well done to them. So you can see our new CCG has a lot to live up and certainly has a legacy to hold, but also has within its all expertise and experience, along with the clinician staff and those well-established partnerships, with a strong proven record of improving things for patients and the public. By working together, I believe, and all of us believe, we can share and spread this good practice for the benefit of all of our residents in North East London. As well as managing the health service response to COVID-19, 2020-21 has been an extraordinary year, with the pandemic revealing the true extent of health inequality in our population. Many of our boroughs have identified high levels of deprivation and inequality, with more than 50% of our population identifying as Black, Asian and minority ethnic. 3 of our 7 former CCGs are in the 20 most deprived in England, and Newham is the most diverse borough in the country. We began rolling out the biggest immunisation programme in NHS history last December and have been administering tens of thousands of vaccines every day to our population. I think we're over 2.2 million mark now for vaccination. This is an incredible achievement and a credit to everyone. We have been delivering these vaccines with partners in a range of settings, including pop-ups in the place of worship, on housing estates, shopping centres, and even in West Ham's football stadium. More than ever before, we have needed to join on our joint strength and experience across North East London to respond to the pandemic, to learn from it, and to ensure that despite our challenges, we continue to provide the essential healthcare to our population. It still remains a huge challenge, and I'm pleased to say I'm really proud of the way my fellow GPs, our directors, our CCG staff at all levels have stepped up once again to work tirelessly and effectively meet the challenge ahead. Their skill, fortitude and resilience, together with that of our partners, has succeeded in keeping the local NHS running through the most challenging ever year. I would also like to have this opportunity to mention those lives lost of the people in North East London and the work in health and care who supported them. Many of them were our colleagues, friends and family members. We remember them for all that they did to care for local people. A number of our staff supported the pandemic response by being redeployed to work directly with our partners, supporting hospital discharging, distributing PPE across our area, managing infection control in nursing and residential homes, and setting up safeguarding processes at the Nightingale Hospital. All fantastic work. My GP colleagues have been remarkable and stepped up magnificently. With all of our practices continue to provide services to their patients throughout the pandemic via virtual consultation, including online and by phone, as well as seeing people face to face when possible. People who cannot access online services can call to be given a consultation, and those who find contact to get through to their practice during working hours can do this at a more convenient time. It's an approach we are making business as usual, and it means we can tailor for individual patients at a time when demand has been rapidly increasing. So to say thank you to all the people of North East London who have supported the NHS and all of us through a very difficult time. We've pulled together as a community, and the appreciation for the local NHS has been strong. Sadly, I have been hearing, and all of us have been hearing, more examples of unacceptable behaviour and even violence being directed at the NHS and care staff as we try to do our best to keep people safe. We are working with our regional and national colleagues on a campaign to counter this negativity, and I ask all of you and urge all of you to help this with all of us. The pandemic has provided us some fantastic ways of working, be that in terms of the stronger partnership working that we've seen that will now remain in place, or new ways of triaging and seeing patients. As you'll all know, along with the continued pandemic and the current rise in cases, the NHS also has unprecedented backlogs of treatment that we need to tackle together to get people to the treatment they need. The best way we can do this is to plan our services across the NHS and health and care system for the benefit of all. That's what we intend to do. Yes, it is challenging, but I am and I remain optimistic for the future. You will hear more about this from Henry about our plans later. For now, I will hand to Steve Collins, our acting CFO, to talk about and tell us about the finances for last year. Steve.
Thank you, Jagan. Really helpful reflections, and I think it just reinforces the amount of work and the amount of change that we've been through in the last 18 months. So I've got a few minutes now just to share details of the finances for North East London for 2021. I would start by thanking everybody, though, that has been involved from a finance point of view, from a contractual support point of view. I would extend that to our providers, to our local authority colleagues. It has truly been a year that we went into it really not knowing quite how the finances were going to work, and the rules were changing in many cases by the day, especially in the early weeks. So the level of cooperation and collaboration, I think, together has helped us to get through it. And I think as we start to share the numbers and the statutory elements of the performance of the CCGs through the year, I think we need to put it all in the context of just how much volatility and how much work was done to try and keep the liquidity in the system, supporting our local partners and local providers, and making sure that we could get money and resources out to the areas that needed it most at the time they needed it most. So if we just move on to the first slide. So this one articulates the statutory performance requirements for the CCGs. And I would say that this represents the last year of presenting these as 7 different organisations. So for 21-22, it will just be a single set of accounts. But for this year, I'll come on to some of the details shortly. We were reflecting money flowing through 7 separate statutory organisations. So there are six measures on this slide, and I'm just going to walk through briefly each one of them. So the first one says revenue resource use does not exceed the CCG allocation. So this is our statutory requirement not to overspend based on the resources that the government give us. If you read across the 7 CCGs, broadly they reflect the size of our population within the boroughs, and you can see that you have City and Hackney together, and you have Newham reflecting the largest single borough within North East London. Tower Hamlets, however, has historically acted as the host commissioning group for the North East London Alliance, and whilst the numbers there look significantly larger, they reflect the fact that as money was flowing into North East London, a lot of that funding was coming through a single CCG in 2021. So that hosted all of the additional funding for areas like the hospital discharge programs, money that was then flowing through to local authorities, and additional revenue to support the significantly increased costs that we saw through COVID. That said, whilst we operated under two different payment regimes during the year, in the first half of the year, effectively our expenditure was underwritten by the Treasury, and therefore there was a mechanism of claiming costs. In the second half of the year, we were then given allocations for the second half of the year, and as a local system across all our providers, we still had to stay within our statutory duties of break even, and therefore the second measure to stay within the NHS agreed plan reflects those two halves, where we had a half year where we were on a, if you like, a reclaim basis, and then the second half of the year where we had to stay within our break even targets. During that time as well, though, we needed to be within what's called a running cost allowance. These are the corporate costs within the CCGs and now the single CCG. And again, they are broadly a facet of the size of the population that we serve. And across the 7 organisations, we stayed within that. In some areas, we were slightly below. In other areas, we were broadly in line with that allowance for the year. And we have to meet our cash targets. So not only do we have a profit and loss account, an income and expenditure account, but we also have cash targets that we have to stay within. And that's reflective of our use of resources and getting cash out to organisations on a timely basis. So things changed during the year, but the intent was to not let a lack of funding and a lack of liquidity in North East London become a barrier to deploying those services. And again, we met our legal requirements across all 7 organisations for cash. The final 2 would just dwell on those for a minute, because you will see that there are a couple of crosses. So this reflects the NHS Better Payment Practice Code. The standard is that we pay at least 95% by value and volume within 30 days. In the main, we achieved those, but you will see there are a number of CCGs where those targets were missed, albeit we were above 90% in every case. In looking at those, I think, to be fair, some of it reflected some of the confusion in the start of the year. And actually what we found was it was a little bit more polarized, where we were getting payments out to the vast majority of organizations in significantly less than 30 days. And then because of the slightly chaotic nature of the way money was flowing around the system, there was some where there was a bit more delay. And again, you can see that in part in Tower Hamlets, where it was hosting some of the North East London flows. And that's why those targets were slightly short of the 95%. As a system, as a whole, across the whole of North East London, however, we did hit the 95%, but not at an individual entity level. So if we move on to the next slide, this just covers in a little bit more detail where we landed in terms of our overall expenditure. So you can see our range of spend at an individual CCG level ranges between just under 340 million and, as I say, the single largest borough in 2021, Newham at 570 million, alongside Tower Hamlets with a total spend of just over 700 million. And there again is the detail around our running cost allowance. So we achieved our break-even duty across each of the organisations. Indeed, we turned a small surplus as we merged into a single organisation on the 1st of April 2021. If we move on to the next slide, What we've tried to do here is just articulate both the size of the budgets across our 3 ICPs. So for the year, we had an ICP covering Barking and Dagenham, Havering and Redbridge, City and Hackney, and Tower Hamlets, Newham and Waltham Forest. And the pies show that each of those areas spend £1.3 billion, £1.7 billion, and 500 million for their residents and within their boroughs. Broadly speaking, half of that money goes on acute services, and that's our acute services within our own boroughs, so Barts, BHRUT, and the Homerton, but also other services out of area. In some cases, expenditure for acute services to the independent sector to support the recovery. And as we are well aware from the last year, some of that fundamentally shifted in terms of our requirement to stand up additional capacity, both in terms of normal G&A beds, but also some of the additional demands in terms of intensive care and support for patients that were seriously ill with COVID. So if you look at the right-hand side of the pie charts, the highest area again is in TNW, Tower Hamlets, Newham, Waltham Forest. In practice, the additional 5% there is reflective of the additional demand on acute services through the different waves in the pandemic. The other areas then reflect the expenditure within mental health, which is generally between 8 and 14% across each of the boroughs. Community services, where is around 8 to 10% of our total spend, and that's fairly consistent across all 7 CCGs, all 7 boroughs and the City of London. And then we have the other pieces of the pie which reflect other non-acute services. So we have areas for learning disabilities, continuing healthcare, and our primary care services, which consume about 20% of our overall expenditure. And then the running costs we've touched on account for 1% of our total costs. So hopefully that gives people a flavour as to how some of that money is spent. What it doesn't do is reflect the additional expenditure that we had into, in particular, some of the work to support services outside of the hospital. So something called the Hospital Discharge Programme, which we worked with, again, local authority partners, standing up discharge services. They were kept slightly separate from the normal allocations and managed on a cost recovery basis. So there is additional expenditure that was reimbursed from directly from the Department of Health, along with nationally funded programs like the vaccine and the test and trace programs that aren't part of our day-to-day running, in addition to what we have here. So if we just move on, so having said it was a year like no other in many, many ways, we have managed to ensure that we've achieved 7 clean audit opinions. So I'd like to thank our auditors, both internal and external, for their continued support through the year. And they basically have to sign off an audit opinion that says that all material aspects of expenditure and income have been applied appropriately and as intended by Parliament. They have to confirm that the information given in the annual report is consistent with those financial statements, and that the remuneration report has been audited and properly prepared in accordance with the requirements directed by NHS England. And I'm delighted to say that they were an unqualified opinion across the board for all 7 organisations. So the final sign-offs from the auditors are included at the bottom of this slide, confirming that we maintained our statutory duty to manage our expenditure within our limits, that they gave us an unqualified value for money conclusion, which is a slightly separate piece of work that they need to do to make sure that we are using the money appropriately. And then they also have to give us what's called an opinion for regularity, and we received an unqualified opinion for those in 6 out of the 7 CCGs. So that's the finance summary for 2021. Some of the measures that we had in year will continue or have continued into 21-22, but as I said at the beginning, we are now managing that as a single CCG. So that concludes the update on the finance slides. I'd like to thank everybody again for all of their support during the year, and I'm going to hand over to Henry Black, who's our Acting Accountable Officer for the North East London CCG, and he's going to share in a little bit more detail some of our plans for North East London for the upcoming year. Thank you.
Thank you very much, Steve, and thank you to everyone else. So, hi everyone, my name is Henry Black, and I'm the Acting Accountable Officer for the North East London CCG, and I'm also the Senior Responsible Officer, the SRO, for the North East London Integrated Care System. Excuse me. So I would just start by saying thank you to Steve. Steve has been acting into my substantive role as the CFO for the past nearly 6 months now, and so all of the everything that Steve was presenting in terms of the finances, I have the scars on my back to be able to bear and say just what a tough year it has been for the finances last year. A year like no other really for NHS finances. So a huge thank you to Steve and the rest of the team for successfully guiding us through the finances and enabling us to present a clean audit opinion and a successful set of accounts in front of Parliament. So thank you to Steve and the rest of the team. So I'm delighted to be here at the first AGM for the North East London CCG. I'd like to extend a hugely warm welcome to members of the public. I see we've got lots of members of the public here today, which is great. I'd like to thank you all for joining us. It's also great to see several of our locally elected council members as well on the call. I can see lots of faces there, which is great, and other people from our local authorities. And I would really particularly like to extend a huge thank you to those local authority partners for the quite amazing joint working that we've done over the pandemic. Steve mentioned the hospital discharge programme. What an incredible achievement that was, to be able to work in such close harmony, really, to keep people safe and keep people well during the pandemic, and also the work that we've all done collectively together on the vaccination programme. And a huge thank you to our local authority partners for all the support they've given us delivering that programme. As a CCG, we're here to ensure that local people have access to high quality, safe, effective and responsive health and care services. And I'd like to thank Dr. John as well, and I'd like to join him in thanking the people of North East London for your support during this challenging time. It's been, as has been said, it's been an extraordinary year, 2021, a year like no other. Part of the reason we are here today in the AGM is to look back on the last year, and I've already mentioned the fact that for most of the financial, well, for in fact all of the financial year 2021, I was actually the substantive CFO. I've been the acting accountable officer since pretty much the middle of March, and for that period, before we merged the 7 CCGs into one single CCG, I want to start by thanking my predecessor Jane Milligan, who's moved on to her to a new role as accountable officer in the Devon system, but who for 2020-21, the year in question that we're looking back on, was the accountable officer for North East London. So as this is in part a kind of look back and a review of the financial year 2021, Jane was the AO for that year, so it's only right to recognise the hard work that Jane put in to take us through what was the first wave of the pandemic, when the pandemic first hit, and to also recognise the legacy that Jane has left for her many years. I think 19 years she worked in North East London. An incredible advocate for North East London, and somebody that we will miss. So Jane was a key part of the North East London NHS family, providing leadership across a number of areas, but most recently as the AO for the 7 CCGs. She led the North East London Commissioning Alliance since its inception in 2017, and most recently she steered us through the CCG merger and the development of our integrated care system. So on behalf of the whole CCG and the partners across the system, but also particularly from a personal note, I'd like to thank Jane for her hard work and dedication to the people in North East London over those 19 years, and wish her every success for the future. So turning to the other area of focus for today's AGM, this is not just looking back on 2021, it's also an opportunity for us to look forward. And as Dr. John outlined, this year has continued to be another incredibly challenging time for society as a whole across the globe, but for us in particular in health and care, as we've navigated the ongoing pandemic, the rollout of the biggest immunisation campaign in NHS's history. We mustn't forget that, at the same time as managing the pandemic, and also recovering services back to levels as they were pre-pandemic, which is an ongoing and extremely challenging task, as you will all know. So I'd like to thank Dr. John and his fellow clinical chairs, the other 6 clinical chairs for the other 6 legacy CCGs who are supporting Dr. John in his now role as the single North East London CCG chair. I'd like to thank those colleagues for their continued leadership and support in driving this work. It's been an incredible challenge and an incredibly difficult time. Primary care in particular has been under intense pressure, managing day-to-day demands, as well as the additional pressure from COVID-19 and the vaccination programme as well. A huge amount of the vaccine delivery has been through the primary care networks and through those local primary care partners who are the kind of trusted partners that everyone has relied on, and they've done an incredible job with the vaccines. So I'd like to thank everyone across primary care and across our workforce more broadly in general as well, but particularly primary care, given as we know, there's some, I know Dr. John mentioned it before, but I also want to reiterate the support, my personal support and my personal gratitude to primary care. It's an unfortunate media campaign that we seem to be experiencing at the moment, and it's not one that I would at all endorse. And I would like to place on record my personal thanks to primary care for all the hard work that they continue to deliver on behalf of our patients. I'm extremely proud of what we've achieved together as a CCG, and primary care and all of our partners have been integral to our success. As a CCG, we continue to be grounded in strong partnerships and the really excellent relationships that we've built across the system over many, many years. So those relationships have, as I say, they've been developed, but they have taken on new meaning in many ways during the pandemic. We have a single aim and a single kind of vision in the form of responding to COVID-19, and the way we've pulled together has been extraordinary. So our response to the pandemic and our rollout of the vaccination programme has really demonstrated and brought to light the importance of working together across organisational boundaries to deliver health and care services to local residents. There are many examples that I could give, but I would just like to highlight a couple of examples across North East London that illustrate the strength of our collaboration. So there have been many excellent examples, but 3 that I'd like to highlight in particular. So firstly, the vaccination programme itself. The speed with which we stood up the delivery of the COVID vaccinations before Christmas 2020 was incredible. Over the last year, we've seen mass vaccination sites, we've seen vaccinations delivered in the community to housebound patients through kind of roving outreach teams. We've seen purpose kind of set up sites such as the Broadway Theatre in Barking, which Dr. John and I have visited a couple of times, including the very great fun close down celebration that they had a few weeks ago. We have the centres in Westfield Shopping Centre, numerous pop-up sites in places that enabled people who would otherwise find it difficult to access the vaccine, in sites such as mosques and churches and other community sites. Partners across the CCG, local authorities, our providers, our NHS providers and primary care have come together in such an extraordinary way, and I would like to thank every single person who's been involved in the vaccination programme for their contribution and for the success. And as Dr. John said, the mass event that we had at the London Stadium, as I call it, he likes to tell me that it's actually called the West Ham Stadium. I call it the London Stadium. Was a real kind of an example of a kind of positive, really positive community event with everybody pulling together, and I found it really uplifting experience to be part of that. Secondly, the long COVID clinic. So we have a collaboration between BHRUT, NELFT and the CCG, to support patients with ongoing COVID-related difficulties. People will recognise long COVID is the initial stages of COVID can be devastating to people, but for a huge number of people, that stage, people then recover from it, and fingers crossed they make a full recovery. But sadly, for a lot of people, that's not the case, and they continue to suffer symptoms for a long time after their initial infection and their initial hospitalisation. So long COVID is a condition that we're still learning about, and it's going to continue to be with us for many years, we expect. But we have great innovative work between BHA, UT, Nelft and the CCG to support patients with those ongoing COVID-related difficulties. Patients have been able to draw on the expertise of colleagues from multiple disciplines to treat long COVID in a one-stop approach, which involves physiotherapists, occupational therapists, also clinical psychologists, because you can't underestimate the impact that such a devastating and shocking spell of illness can have on people who would otherwise have been fit in many cases. Some patients even receive singing lessons as part of their therapy, which I always thought was lovely, a lovely touch. And this innovative approach received a range of media coverage early this year for the impact it's had on patients recovering from long-term effects of COVID, and the success of that clinic has been part of a wider rolling out and learning for other clinics, other similar clinics across London and across the country. And then the third kind of little showcase that I wanted to highlight was the Mile End Early Diagnostic Centre, which I visited recently. So this is a really good example of collaboration. This is Barts Health, BHA and the Homerton University Hospitals all working in partnership together to create a new innovative early diagnosis centre at Mile End Hospital, which opened in March of this year. The centre provides additional services for local people who are living with conditions that could increase their risk of cancer, such as gastric ulcers and inflammatory bowel disease. So these dedicated facilities will help to detect disease early and will aim to boost survival rates. So this is a fantastic facility that effectively operates as a form of surveillance to people who are at risk, and those people can then receive continuous support. The centre will also closely monitor patients with early stage cancer who don't yet need treatment right away, but may just need to be kind of kept under surveillance and kept under precautionary care, and keep them as well as they possibly can for as long as they possibly can. But also to initiate treatment if it's needed as early as possible, and to minimise the impact of that. It's one of its first of its kind nationally. The main aim is to provide specialist person-centred diagnostic care for people in North East London, and it offers patients a consistent quality of service and a greater choice over where and when they receive their treatment. And it's open to patients all across North East London. So these are some of the fantastic examples of how the CCG has supported partnership working for the benefits of patients across North East London. I'd also like to highlight some achievements internally. Staff welfare is a huge priority for us. We know it's been really difficult and really challenging, and we know that our staff survey results have not always been as high as we would like them to be. This is an issue across all of health and care services, we know, but we are particularly keen to do everything we can to improve those. So some of the initiatives that we've started. So we've established 4 diversity networks for staff. The Black and Minority Ethnic Network, the Women's Network, the LGBTQ+ Network, and the Ability Network. So these networks provide an open and inclusive space for staff to raise issues, and they also provide a platform for people to discuss those important issues. I also want to increase the extent to which they feed into the way that the CCG functions, and going forward the ICB as well. So that they're not just there for staff to kind of have an opportunity, and it's a very important role is for staff to have a safe space and opportunity to discuss these issues, but it also needs to then feed into the learning for the CCG and the way that the CCG manages its strategy and manages its functions. So some of the topics that we've covered today include menopause awareness, neurodiversity in the workplace, Black History Month, the importance of the use of pronouns in email signatures, which we've now rolled out across all of our workforce. The networks have been shortlisted for an HSJ award in November in recognition of their impact so far. So fingers crossed, I think they absolutely deserve to be recognised, and I think it's fantastic they've been shortlisted. But let's hope they get the recognition that they deserve. Beyond this, we've also undertaken work to develop line managers, explore culture and leadership for the organisation, and ensure staff are contributing to the development of an organisational-wide vision. So we want the vision for the new organisation to be bottom up, and for everybody in the organisation to have the opportunity to contribute to that. We don't want it to be something that the SMT go off in a darkened room, decide, and then hand down to everyone. It's important that it reflects how staff are feeling and the way the organisation runs. So I've been personally incredibly proud to lead the CCG over the last 6 months alongside Dr. John, and I look ahead to the next period as we prepare for the implementation of the expected new health and care legislation that is currently, I believe it's had its second reading in the House and it's continuing to progress through Parliament. I'm really excited about North East London's future and the opportunities that closer collaboration will bring as well. So although we've got much to be proud of, particularly in how we've come together as a system to respond to the pandemic, we do absolutely recognise that we've got much that we still need to do. We still have a huge elective backlog, and as a result, we had a backlog anyway, but the pandemic obviously pausing all of the routine elective operations for a number of months means that across the whole country we have a huge backlog, and we are particularly affected by that. We need to address that, and we also need to address the health inequalities that have become so prevalent over the last 18 months, and to ensure that we're delivering effective health and care services for the people of North East London. We want to ensure that no matter where you live across the patch, you have equal access to services and you have equal life chances, and that is our commitment to make. In North East London, we have a history of innovation and forward thinking, skilled and committed clinicians, and a commitment to ensuring the best life chances for local people. So I look forward to continuing to work with Dr. John and the Borough Clinical Chairs, as well as with Marie Gabriel, our ICS Chair designate. And we will also be building on the strong foundations of our 7 legacy CCGs, with primary care continuing to play a leading role alongside a wide range of clinical leads, working hand in hand with patients and residents to achieve the best outcomes for people and to address our priorities and challenges. So before I hand back to Jagan, I just want to say a final thank you again to all of our staff, all of our fantastic clinicians, all our partners, and in particular all of our members of the public who contribute to everything that we have achieved together. So back to you, Jagan.
Thank you, Henry, and thank you for all of those kind words, and thank you for all your support and leadership through this quite difficult time, and of course the team that you lead. So the last thing on our agenda is the public questions and answers, and we will now go through some of the questions the questions that were sent to us in advance, and the 2 questions that were submitted in the time that we'd asked to. Thank you for sending those in. I will read out these questions, and myself and Henry will do the responses, which of course we will publish at a later date. So the first question was from Kate, one of the CCG members of staff. I'm going to probably hand this question to you, Henry. The question is, I understand that this is the AGM for the 7 North East London CCGs, but I'd like to know, what would you like the legacy of North East London CCG to be when we hold the AGM next year? And what would you like to be able to report? Henry.
Thanks, Jagan, and thanks very much to Kate as well for asking the question. So it's a really good question, and it's one that goes to the heart of what we're about. Implicit in the question is the fact that making reference to the North East London CCG and next year. So the CCG, as we know, we merged in April of this year, and the CCG will only exist for another 6 months, by which time we will have become an ICB, which is a little bit like the musical chairs that we seem to in the NHS. We seem to have reorganisations every few years, and this is another one. But it is really, really important that we continue to focus on the work that we're doing and we don't allow that to be a distraction. So it's a very, very good question about what do we want the legacy of a single CCG to be this time next year. So I would like us to have some tangible examples. I've described some of the positive differences that we are seeking to make for the people in North East London, that we always aspire to make, and some tangible examples that I read out earlier in the meeting. As we know, it's been a really difficult time for us all, and again, we are going to be we have to recognise we'll be facing an extremely challenging winter. But I guess just looking ahead over the next 6 months, the priorities are broadly in line with the delivery priorities that we have agreed across London. So those will be returning our health and care services to as much as we possibly can to what we would consider to be normal, or possibly we kind of refer to the new normal, which is not necessarily quite the same as it always has been, because we have new and innovative ways of allowing people to access services in the way they want to, but for those people who still want to access services in the traditional way, we need to get those back to normal, and that has largely happened, so we can encourage those people who may have stayed away to seek advice and care and not to put that off. The second thing would be around making significant inroads into the waiting lists that have grown as a result of the pandemic. I mentioned that earlier, and we, largely speaking, in March of 2020, just at the end of the period before the 2021 financial year, pretty much across the whole of the country, elective surgery and elective care was suspended. So routine operations were essentially suspended by the government as a result of the pandemic, and so as a result, it took a great, all of our efforts and all of our resources to respond to the critical component of the first wave of the pandemic, and we had ITUs were full of people with COVID, and we had anaesthetists working in ITU and all the rest of it. So at that time, obviously, elective care, so routine operations, had to be suspended nationally, and that meant that our waiting lists have grown as a result of that. So the second priority will be that we will, by the end of the financial year, will have made significant inroads into the waiting lists. We'll have significantly reduced the number of people who have sadly been waiting for a long time. So we do have people who've been waiting more than a year because of the suspension of elective care. We hope we've reduced that by nearly 50% already, and we hope to reduce that further. The third thing will be ensuring that we have a safe transition from the CCG to a new organisation in April, the new Integrated Care Board, and I want that to be built on the culture of collaboration across partners, rather than what we've had in the past, which the legislation is sweeping away, which is getting rid of the old competitive model of an internal market. So having taken the CCG into the new ICB organisation will be the third thing that I would like us to have as our legacy. And then finally, the most important one, which is improving access, experience and outcomes for our patients, with the overriding aim of reducing health inequalities. Certainly we have learned a lot from the pandemic, but in particular we've learned a lot from the rollout of the vaccine programme. We always knew that we had health inequalities, and we had differential access, and we had challenges in the way that all of our patients are able to access the same level of and quality of care. But certainly our experience of the vaccination rollout has really shone a light on that, which has been devastating in many ways. But it's something that we can use, turn into a positive, and use going forward. We can use the learning from that. And so it's going to take a lot of time. It'll take more than the 6 months that we have left as a CCG. But if we've laid the foundations for that improvement, that will feel like, I believe, a positive legacy. So that would be the way I would want to describe the legacy that I would want us to see in 12 months from now, Jagan.
Thank you, Henry, and I echo that. Thank you for summarising that. It's great. Thank you, Henry. The next question we have was from a member of the public, Liz Perloff. The question was, in 2020, North East London CCG admitted that X-rays, MRI, CT and other scans were not being read correctly by hospital services bought by this NHS department. Why did North East London CCG ignore evidence from members of the public of inaccurate medical imaging in 2017, 18, 19? In light of this, why has North East London CCG ignored concerns raised in 2020 and 21 that their orthopaedic and musculoskeletal departments are unable to tell the difference between muscle tendons and bone joints, leading to incorrect treatment and avoidable pain and suffering? Thank you, Liz, for this question. And I've got to say, we're incredibly sorry to hear of cases where people have experienced avoidable pain. This is certainly not what I or any of us want for our patients and residents in North East London. We do take issues like this raised about the quality and safety of our services very seriously. We investigate all these issues as we do with organisations we commission. In addition, the Care Quality Commission, the CQC, as the independent regulator of health and social care services, plays a key role with us in monitoring, inspecting and regulating services to ensure that they meet quality and safety standard. Where we or the CQC find that services aren't the standard we expect them to be, we agree actions and provide them with the providers the things that they should be addressing. So where services are experiencing or falling short, we're encouraging people like yourself to let us know of the providers through their feedback and of course through the complaints process. If anyone or any of our residents do not feel that their concerns have been addressed, they can address this directly with the Complaints Ombudsman. So those are the two questions that were sent to us as well. And of course, we will provide written scripts of this through the CCG later on. So on that note, and I'd like to kind of officially close the meeting of the AGM. I'd like to thank my fellow speakers, Henry and Steve, for all of you attending the AGM. I wanted to say again, thank you to all our partners, our local authority, our organisations in the communities, our hospital colleagues, our primary care colleagues, and most importantly, our residents who've been absolutely remarkable. And there are so many stories that I've had of some of the fantastic work that people have done through this year, through the pandemic. And really, it's very inspiring to hear. And certainly from me, from a clinical perspective, I certainly have seen some fantastic solutions where people and communities come together. And certainly, as a CCG, we would love to embrace this further and certainly develop it further. And on behalf of my 6 other colleagues, the clinical chairs, Professor Sam Everington, Dr. Mohammed Navki, Dr. Mark Ricketts, Dr. Atul Agrawal, Dr. Anil Mehta, and Dr. Ken Aswani, all who are clinical chairs in North East London in those boroughs. We'd like to really thank all of our clinical teams and all our care professionals who've been absolutely marvellous with this. I certainly would encourage if you'd like to get involved with our work or find anything more, please visit our website and engage with us on social media. We're always keen to hear from and work with local people. And I want to thank you once again. And I'd like to close this meeting. Thank you very much. Thank you.